Hey everybody, Sean Keating here. I want to welcome you to the Dental Up podcast show by Keating Dental Art. Today we're going to be talking with my nephew. He's Dr. Casey Keating, and he's from Asheville, North Carolina. What's happening, Casey? How you doing, man?
Doing great, Sean. Glad to be on the show. Thanks for having me.
Today, I guess we were calling you earlier, you had an emergency come in, and you were even popping out teeth. I mean, what happened today? You had like an emergency or something? Or
This really nice lady come in, and she's been in some severe pain for a couple days, and a couple lower molars weren't restorable and needed to get them taken out. So took those out and took out the upper molars in the same spot. A lot of decay way below the gum tissue, and turned surgical, got them out in a reasonable amount of time, and she's real happy for it.
unbelievable. That's so cool. I can't believe you're extracting teeth.
And then I landed a job in Asheville. Bought an office last summer, about a year in. Office has been there for 30 years, and I'm the third dentist. I walked into this one in Asheville. It's in downtown Asheville. The building's in 1906, historic old granite building, and I walked in and I fell in love, and just charm everywhere in this building. And I told him, man, I was like, I'm buying this dental office.
Can you believe that, dude? Keating's got big wavels, man. They just go all in. Now, what happened? Did Pops help you out on that, or did you get the loans on your own, or how'd that work?
Got the loan entirely on my own, and got the bank the loan 100%. About a $500,000 loan for the practice itself. The dentist I bought it from is a really, really great guy, and did good work and had a good rapport with the patients, and certainly gave me a good foundation to work with. But I'm telling you, as much as you learn in school, and after 5 years of associating, working for a bunch of dentists, I still wasn't prepared for business ownership. It's a whole different world.
Oh, I bet.
Also, one of the more enjoyable sides of dentistry, just having the pride of ownership and working on a reputation and just doing good dentistry. I've enjoyed dentistry every step of the way, but until buying the office, it's been more of just a good job, and now it's more of a passion, and certainly have a little more pride in it.
That is so neat, Casey. And, you know, with you being so young, how do the patients like seeing you kind of like a Doogie Howser, you know?
Honestly, maybe it's because I'm going bald. I don't know. I don't think I got that from you,
You
Sean.
got lots of hair up there, baby.
No one seemed to mention age much. It hasn't really deterred anybody. And first couple years out of dental school, and you get some age apprehension here and there, but really not that much. I think a lot of that's just how you handle yourself. If you're confident and display confident, if you exude the confidence, then patients will pick up on it, and then age isn't really relevant. So.
No kidding. Do you think you'd ever just specialize in endo sometime, or no?
Well, I thought really long and hard about that, as you might imagine. And there's a lot I like about endo and the profession. I'd love to work with my dad and all these things. But what I really like about dentistry is just being able to do everything, kind of the diversity of the treatment. And like we talked about earlier, a lady comes in, needs some extractions. I like being able to do that. It's nice when somebody can come in and I can figure out their problem, diagnose it, present good, reasonable, practical treatment options, and explain it and educate it. And it just ultimately, I find that more rewarding than honing in and specializing on one treatment.